Welcome to the Dr. Mudgil podcast. This is episode 135. We are just cruising our way through June here. Father's Day is behind us. Last week of school for my kids. It is hot as hell here in New York, 90s. I think it's going to be 90s later in the week, and it really feels like summer is here, and I love every second of it. So I'm not going to waste much time here because there's a lot to get into. I'm going to get into the content of this podcast, and it's actually a subject that, as many of you know, is near and dear to my heart. It's about how private health insurers are just effing up our healthcare system. And there was a great article in the New York Times in the Wall Street Journal last week that one of my colleagues forwarded to me, I assume in an effort to rile me up, and he succeeded, and really got my blood boiling. And I want to share it with you guys. I want to discuss a little bit of it. So this article was in the Wall Street Journal. I'm actually going to read it to you guys just because it's very powerful and very accurate. And it was in the Wall Street Journal. I think it came out on the 13th, which was last week. And the title of this article is "What Happens When Your Insurer is Also Your Doctor and Your Pharmacist." Health insurers like United Health Group, the absolute most vile company that is in business in healthcare, that's me, that's not in the article, that editorial, are seeking control many parts of our healthcare system, creating potential conflicts of interest. So I'm actually going to read this article. I'll probably read it in its entirety, but I may add some commentary along the way. So if there's any sort of any commentary about like United Health Group being a vile, disgusting institution, that's actually coming from my heart, not from the article. But I will anything I editorialize, I'll point out. So here goes. America's health insurers don't say this openly, but it isn't secret that many of them would like to be a little more like United Health Group. Just as Amazon is the e-commerce industry's 800-pound gorilla, United Health has built a sprawling healthcare services company that shows no signs of slowing down. With annual revenue of $372 billion, that's billion, in 2023, it ranks among the 5 largest companies in the U.S. on that measure. Its stock, meanwhile, has returned more than 600% in the past decade. United Health's success has been fueled by its expansion beyond insurance as its care delivery and solutions unit, Optum, another vile company, steadily acquires a vast array of health service companies, from a pharmacy benefits manager to specialty pharmacies to doctor groups and surgical centers. Over the past 2 decades, Optum has spent about $82 billion on nearly 100 acquisitions, according to a tally by Raymond James analysts. Much like the rest of the U.S. economy, America's healthcare system has consolidated in recent decades, creating giant hospital systems, chain-owned medical practices, and vertically integrated insurance conglomerates. Immense scale can drive efficiencies and reduce cost of care. But in the highly complex and opaque world of U.S. healthcare, where giant companies always seem to be a step ahead of regulators, it also raises potential conflicts of interest and opportunities to game the system. The benefits of size often flow to those companies, not patients or the employers and taxpayers footing much of the bill. Insurers are, relatively speaking, still in the early innings of acquiring physician practices, with hospitals controlling a much more significant portion of the nation's doctors. The Affordable Care Act in 2010 may have fired the starting gun. While it expanded access to health insurance for millions of Americans, Obamacare also spurred insurers to push deeper into other services because it effectively capped their profit margins, requiring that they spend 80 to 85% of what they collect on medical services. If the government limits what you can get to keep on the insurance side of the business, why not own the places where the money is being spent too? As health insurers have shifted from being solely payers to providers as well, they're increasingly paying themselves. United Health's so-called intercompany eliminations more than doubled in 5 years to $136 billion in 2023. At the same time, Optum's contribution to overall profits has grown much faster than United Health Insurance's arm, and is now responsible for more than half of the company's earnings. Rivals aren't sitting still. CVS has acquired a pharmacy benefit manager, Insure Aetna, a primary care chain, and a home health provider. Insurers Cigna, Elevance, and Humana all have invested or partnered with medical practices as well. Cigna also owns one of the largest pharmacy benefit managers in the country. A key growth driver for United Health is Optum's steady acquisitions of doctor practices. Optum now has ties with 90,000 doctors, about 10% of the country's physician workforce. United Health Chief Executive Officer Andrew Whitty told a Senate hearing last month that his company only directly employs about 10,000 of them while affiliating and contracting with the rest. In theory, integrated systems, when the insurer and health provider are combined under one roof, can help hold down healthcare costs because it effectively puts the insurer and doctor on the same team. This sort of alignment exists in some fashion in most rich countries where the cost of care is much lower. It has been adopted in some parts of the U.S. too, most notably by Kaiser Permanente, which combines nonprofit insurance plans with hospitals and clinics in California. United Health isn't quite fully integrated, but Optum has more than 2 million patients who are insured by United Healthcare under a payment model known as value-based care, in which a clinic is paid a set amount a patient. This setup is supposed to encourage more preventive services and less waste. Now, this is an editorial. It actually provides value only to United Healthcare because they basically screw patients over, and that's how they increase profits. But we'll get into that later. Our mission is to improve outcomes, experience, and affordability, says Dane Schumacher, United Health Group's Chief Strategy and Growth Officer. To have an impact at a system level, it really requires a combination of capabilities with aligned incentives. Robert Tyler Braun, an assistant professor at Weill Cornell Medical College who has researched Optum extensively, says that many doctors may prefer working for Optum rather than a large hospital system. As much as they hate to admit it, they speak a similar language, he says. While hospitals make their money by keeping patients in the hospital, insurance companies and physician practices make their money by keeping people out of the hospital. The company says there is a strict firewall between Optum and the insurer United Health, but competitors and regulators have raised concerns that United Health's dominance can hurt both rival doctors and insurers. Earlier this year, the Justice Department launched an antitrust investigation into United Health, the Wall Street Journal reported. Investigators are looking at a range of anti-competitive issues, such as whether the insurance arm of the company favored Optum-owned groups in its contracting practices. The economic relationships between Optum and United Health, those are negotiated at arm's length, and we are transparent about those relationships, Schumacher says. And from my experience, having worked on both sides of the house, I can tell you that the Optum and United Health negotiations are often the most difficult negotiations, at least the ones I've been close to. Well, I call bullshit on that. But anyways, while Big Pharma used to get most of the flack in Washington, worries that insurers, and especially United Health, have grown too large have started to shape some of the political discourse. Criticism has intensified in the wake of a massive hack on the conglomerate's medical claims platform, Change Healthcare, that crippled the U.S. healthcare payment system. During a recent hearing on the Change hack, Senator Elizabeth Warren called for breaking up United Health, a monopoly on steroids that has brought up every link in the healthcare chain, allowing it to jack up prices, squeeze competition, hide revenues, and pressure doctors to put profits ahead of patients. United Health argues that despite its size, when you zoom into local markets, there's still plenty of competition. Now, I'm no fan of Elizabeth Warren, but I think she is actually right on this one. But the government doesn't need to break up United Health to rein in the industry. Since Uncle Sam is ultimately one of the major payers to insurers through Medicare and Medicaid, more humdrum change, such as an overhaul to the payment coding system, can have a major impact on profits. Much of the vertical integration in the industry has focused on the Medicare Advantage business, the sector's golden goose. And I have a podcast talking about Medicare Advantage systems, which are, in my opinion, absolute total utter bullshit and only benefit the insurance companies. You can listen to that podcast. We'll put a little link to it in this podcast so you can reference back to it. Back to the article. These are the private plans in which the government pays insurers a fixed rate to manage the care of seniors. The sicker the patient, the more the government pays. In recent years, some insurers' acquisitions seem targeted at controlling the Medicare coding apparatus. If you control the doctors who code patients, you control how much you get paid, explains Lauren Adler, a fellow at the Center of Health Policy at the Brookings Institution, a nonprofit research organization. United Health and other insurers argue that they are simply coding patients according to their risk profile and that they comply with Centers for Medicare and Medicaid service rules. Again, I call their bullshit. But they have been accused of abusing the system by coding patients too aggressively. An investigation by the Office of Inspector General of the Department of Health and Human Services found that Medicare insurers received $9 billion in questionable payments in a single year. United Health is far from alone. Many insurers, including Kaiser Permanente, Humana, and Anthem, now known as Elements, have been accused of controversial billing practices. Here, too, though, size matters. The report implied that United Health received approximately 40% of those payments. Some of those practices may have started to backfire, at least for now. Under the Biden administration, CMS has made changes to the coding system that will significantly reduce plan profits. Health insurers are supposed to be gatekeepers, making sure patients get the best care possible while keeping costs in check. That balance is harder to achieve when they become your doctor and your pharmacist, too. Well, that's the article, and that's a great article. Now, I'm going to steal a line from one of my favorite fitness influencers. His name is Eddie Abu, and he always talks about nutrition, how we're just being kind of gamed by the system and offered all of these foods that are really not nutritious, which I agree with. And he uses the line, people, we need to wake the fuck up. And we all need to wake the fuck up. Doctors and patients. Listen, I've said it before. There's nothing more pure than the doctor-patient relationship. Doctors go to school for 11 to 15 years to learn the art of practicing medicine to take care of patients. Much of that, many doctors are hundreds and hundreds of $1,000s of debt. They make minimum wage during their residency training because they want to learn the skills necessary to take care of patients. Patients come to doctors because they're sick and they need help with something. And doctors want to help their patients. That is the extent of the transactional relationship between doctors and patients. But there are four evil forces on the other side of the fence, namely private health insurance companies like United Healthcare, the most vile, disgusting institution that exists, and the others are not far behind. Sprawling hospital systems, which are basically usurping doctors' practices and just gaming the system to maximize profits for themselves. Pharmacy benefit managers, who are just the most shady, shadowy institution that exists, and now that private health insurers are purchasing them, they're like in cahoots with each other, basically also to maximize profits. And the last are private equity companies. Those four evil forces: private health insurers, sprawling hospital systems, pharmacy benefit managers, and private equity, are destroying the purest relationship that exists, namely the doctor-patient relationship, the teacher-student relationship, pure relationship, the parent-child relationship, pure relationship, the doctor-patient relationship, pure relationship. All of these private health companies are basically gaming the system in any way they can to maximize their profits. There's a reason why we all, including myself, have high deductible plans. We pay a shit ton in our monthly premiums only to find out that we have to pay $4,000 or $5,000 more out of pocket before our insurance, quote unquote, kicks in. Why does that exist? Because this is some strategy that private health insurers are employing to maximize their profit. These companies make billions and billions and billions and billions of dollars of profit. I think this article mentioned that United Healthcare made $263 billion in revenue last year. Much of that is profit. All of these Medicare managed plans that are administered by private health insurers, they're basically using our taxpayer dollars, where they're capitating, to United Healthcare. Okay, if you take care of 1,000 patients, you get this many dollars, and they're getting billions of our taxpayer dollars. And you know what United Healthcare does? They want to keep that money. They basically, the money that's given to them, if they're taking care of hundreds of thousands or millions of patients, they get, X amount of billions of dollars, our taxpayer dollars, you and me are paying for that. And they want to hold on to that money. They want to keep the money in the pot. As I've said before, private health insurers love you if you're healthy. You're paying your premium and you're not using healthcare. You're basically a profit generating center for them. The minute you get sick, and God forbid you get really, really sick, and you cost them money, they quite literally want you to die as fast as possible. But while you're dying, they're going to make sure they maximize your pharmacy benefits because they own the pharmacy benefits company. Now, many of them, and if you're a doctor who works for Optum, you've gone to the dark side, but they manage many of the doctors who are caring for you now. It's a totally incestuous system that is fucking patients and their doctors over. And we all need to speak up. Please, I'm shaking you through this camera and through your earbuds. We all need to wake up. We need to be vocal about this. Our elected legislators are in bed with these criminals that are exploiting the public of the United States of America. Doctors want to take care of the patients. Patients want to get care from their doctors. There's these four evil forces on the other side of the fence that are polluting that pure relationship. And it's up to us, it's up to patients and their doctors to speak out against this. So that's food for thought for this weekend. I hope it stimulates your mind a little bit, gets you riled up, gets you angry. Call your congressman, call your senator, call your local elected officials. Write a nasty note to United Healthcare. We all need to speak up. Post on social media, make a TikTok about it, make an Instagram post about it, share your story, share how you have gotten screwed by private health insurance companies. The more we speak up, the more chance there is for the needed change that we have to transform this healthcare system. And it's up to us to lead the initiative to do so. So have a wonderful, restful weekend. Come in with your fists ready to attack these evil companies next week. Let's get it.